Today's episode is brought to you by the premium content subscribers on the Golf Intervention Substack. And we would, of course, like to thank all of our listeners for tuning in. You make it all worthwhile. If you would like to support the show or sign up for our free newsletter, you can do that at thegolfintervention.substack.com or follow the link in the show notes.
Welcome back to the Golf Intervention Podcast. We have a special guest on the show tonight, Dr. Andy Royalty. He is a doctor of physical therapy and the founder of the Royal Treatment Therapy and Performance. And I will say, Andy, if your last name is Royalty and you're a physical therapist, you have to name it the Royal Treatment. You have to. Like, you had no other choice, right?
When I came up with the name, I was like, I ran the different names of, businesses by one of my good buddies who's a physical therapist. And I was like, it's way too corny to do the Royal Treatment. He's like, no, that's perfect. It's perfect because your last name and you're going above and beyond for your clients. So yeah, that's kind of how it came out.
And you do treatment. So it's like, I just don't see how it could be anything else. So I think you picked the perfect name for your establishment there. And Andy's located here in the greater Richmond area, also where I am. So we have some clients who work with both of us, and we go to the same church. So if you're watching this on the YouTube, you'll see the chapel hat that I've got on. So anyway, a very, very good physical therapist and trainer, and we're excited to have him on. And really the reason that we're having him on is because I wanted to have a discussion around golf and pain. I think it's one of those things that people don't talk about, right? Especially on our end. And I mentioned this on the podcast to Rob before. I feel like people will just straight up lie to us hey, tell me about your shoulder. Hey, something going on with that hip. And they'll be like, nope. And again, I don't think they're lying, by the way. I think that they're trying hard to sort of ignore the pain, right? And so they have to have this mental place of like, it doesn't bother me. It doesn't bother me. But we all know that golf performance is definitely affected when we have pain, and pain is going to come from somewhere, right? And so I want to say that there's ways that we can address it, right? If you go see a person who's very smart and good at what they do, like Andy, we as golf instructors are not going to be fixing your pain in the golf lesson necessarily, maybe with some golf swing stuff that we see. But if you need to get work, you're going to go see a specialist. So we are glad to have you on, Doc. And really, I think that a couple questions I had for you to start with before we get into the pain discussion is, if you go on and you look at his website, which I'll link in the show notes, you'll see he is at a golf course, right? He's at Independence Golf Club, which is a really nice public facility here in Midlothian, which is a greater Richmond area, and the host of the State Open of Virginia. So golf is central to your practice. So have you always been a golfer? Have you always wanted to be a physical therapist and a trainer that was working with golfers? And tell me the origin story of Andy Royalty here.
Absolutely. Thank you, Eric and Rob, for having me on. It's an honor. I appreciate it. But yeah, I mean, I was pretty much a baseball player growing up, and then it was through a couple shoulder injuries where I got into physical therapy, and then I've been a physical therapist since 2014, and then before that, I was an athletic trainer. So a little over 11 years I've been a PT, and it wasn't until we moved up here in 2020 with my wife, 2 kids, and a pregnant wife, and so we decided that I'm just going to start my own thing because I wasn't happy with the way traditional physical therapy was going, with the therapist seeing 20 patients in a day, not really being able to give great care. And so it was a matter of me just being really passionate about golf, and I picked up golf my sophomore year of college, and that's where I got the golf bug. And so we had a course called motor learning in school that was all about neurology and how the brain controls the body. And so one of the projects we had to do was be able to teach one of our classmates a skill that they were not used to doing. And so I had to teach the golf swing to one of my classmates.
Nice.
And we went over the steps on how we taught that. It was that's actually where it kind of started for me. And then when I had golfers come into the clinic when I was working down in Greenville, South Carolina, I used to get super excited. Like I was just like, I couldn't wait for them to come in and me be able to work with them. They wanted to get back to golf. And that's where I was like, gosh, this doesn't even feel like a job to me because I'm teaching somebody how to get back into a sport that they love and they're motivated. They're going to do everything you tell them. They tend to be much more motivated to get better. And so that's where I found that like these people were going to meet me, halfway. I was going to give them all I had, and they were going to work as hard as they could to get back to the sport that they loved. And that's kind of where it started. And I just, I mean, honestly, like every day that 65% of the people we work with play golf. And so just being able to work with those people it's honestly like, it's a dream being able to help golfers get back to playing golf pain free. That is like my passion and I love doing it. So that's kind of where it all started. And I mean, it's just been one patient after the other and other people telling other people. It's just been really neat how, we came into contact with each other. Eric was just, a matter of just working with people in the Richmond area and, word of mouth spreading. So it's been awesome. I love it.
What percentage of your clientele is more athletic training versus physical therapy?
Well, I would say, because I would say it's 50-50 within the
Oh, wow.
65% of the golfers that we see. So 50% are golfers that are dealing with some type of pain and they want to just be able to play like past hole 13 without their back killing them. And then you've got another half which don't have any injuries. They are just in a position where they're losing distance, they're getting older, they know they're losing flexibility. They know they need to do something to essentially get their bodies in shape to be able to hit the golf ball further or just be able to maintain the distance that they have. So I would say it's 50-50 as far as the golfers that we work with.
That's super cool. It's fun to, I know on our side with the teaching end like Rob and I do, it's fun when people come in and they really want to do better, right? They're coming to see you in that sense because they're like, hey, here I am and I want to do better. And so much of our teaching is kind of like, hey, I'm actually doing worse than I used to, and I just need you to help fix me up a little bit. So there's the fix me part of it, and then there's the long-term growth part of it, right? Which is super cool. And through my years in Richmond, it's been almost 20 years in Richmond. I've worked with a bunch of different trainers and physical therapists that I've come to know at the country club, away from the country club. And that team approach to coaching is, I think, so important, that we can kind of communicate with one another. Like you sent me a voice note about a student that we both work with on some of the stuff that he was dealing with. And we can communicate back and forth about things like that. And I think that's really, it's almost imperative to have that team of people that you can really communicate with. Do you find that golf professionals that you've been communicated with are open to you being a consultant on their students' performance, or is it a little more closed-minded, or do you get kind of a mix of things?
Some are definitely open to it because they really enjoy what they're doing. They want to be able to provide the best lesson to the client that they're working with. I think others are so overwhelmed with teaching, but then they have the administrative tasks of running the golf shop. They've just got so much on their plate.
Yeah.
So the last thing they want to do is answer an email or answer a text or do something extra beyond what they are currently doing. Because I mean, a lot of these PGA pros, they're putting in more than 40 hours a week, and
Oh yeah.
they're getting spread thin, and so I respect that, and so I try to say, hey, like I'm here for you if you want to bounce ideas off of me, and some are very open and willing to chat. And Eric, you're one of those people that I love being able to hear from and just being able to bounce ideas back and forth. So yes, it is sometimes challenging, but you can only just be there for them if they want to be accepting of wanting to discuss, some of the challenges and physical limitations that some of their students are having. Then because some of these instructors, as they're working with their students, they're telling them, hey, I need you to turn a little bit more into the backswing, or I want your hands to not get as steep. But in all reality, they may be dealing with some type of flexibility limitation that just doesn't allow them to get into that correct position. And so just being able to communicate with the PGA instructor on those limitations can a lot of times allow them to work around them, or just know that, hey, maybe we can work on a few other things while they're improving that flexibility, or they're working on it over these next couple weeks. So it just gives them a better understanding of how they can work around some of those limitations, and ultimately is going to help the student, long term, and be able to provide, the best instruction that you can during those lessons. Does that make sense?
Yes, that makes great sense. Thank you. And that turns me to my next question here. So everybody, no matter what, wants to hit the ball farther, right? They want to hit the ball a lot longer. And I think that as soon as they think that in their mind, they're jumping to how fast can I swing the club? There's also a launching of the ball element to it that I think we can accomplish in lessons that are way easier than just swinging and hitting it harder. But also, when you take on club head speed as an improvement, there's some real considerations there. Are there not, Andy? Because I think that if the body isn't really ready to take that on, can't that be really detrimental and potentially even leading to injury in a way that's really going to set the player back? What are you seeing from that standpoint?
Right. Yeah, I think that in regards to, there's so many ways to hit the ball further. So, I mean, there's people that they can have the same exact swing speed, but still hit the ball further. I mean, a matter of just hitting it more on the center of the club face is going to allow for you to have a better smash factor, which is going to lead to more ball speed. There's things you guys can do by having them shallow out the club a little bit more, change the angle of attack, decrease spin rate. So there's a lot of things that you guys can do on your end to be able to help them hit the ball further. And then there's other things that, we can do from a physical therapy training perspective, where we can essentially get their body moving a little bit more efficiently so that they can increase the swing speed. So I think it's kind of multifaceted when it comes to people wanting to increase swing speed. And there's the hot topic of speed sticks and, super speed protocol, the stack system. And I think those are good, and people can get more swing speed by using those things. But oftentimes what can happen is if they don't have the adequate flexibility, the adequate strength to be able to be able to handle that speed, injury can, result from that. So that's something that we've seen before too, where people have come to us when they said, hey, I've been doing speed training and I, pulled something in my back when I was, level 3 trying to really push it. And that's where we kind of have to sit back and say, hey, we got to take it a few steps down and really focus on flexibility first before we start really implementing the speed training. But I don't want to get too much down into a can of worms yet. But yes, I see that pretty often.
Like you said, yet we are definitely going down the into the can of worms. Just not yet.
I have a quick question for y'all. So have y'all, because I know y'all have had some other physical therapists on the podcast.
Yes.
Have y'all, Rob especially, have y'all worked with other physical therapists or personal trainers that have your students have been working with that you guys have been open to discussing things with?
Mm-hmm, for sure. Yeah, I've had at least 3 now that I've kind of cycled through. And then now it's to the point to where if they need help, Dr. Michael Kay, he's a physical therapist out in West Coast, working with Tony Greco and Chris Walkie. And they've got an awesome online program that I'll send students to. And that's cool. That's the limit. That's the limitations of what I've found. And I trust Dr. Mike with my education and kind of what I do with my students on a daily basis. So I have no hesitation to send my students his way as well. So now I want to get into pain itself. I know there's a couple different types of pain. I'm not an expert in this. Obviously, that's why we're having you on the show today. But from my understanding, there's acute pain and there's chronic pain. What is the difference between acute and chronic pain? How do you address them differently? What about the understanding of how that works and affects the person? And how does someone like you take that on to help alleviate whatever type of pain they have and put them on a track to being a pain-free person in life and golfer also?
Absolutely. Yeah. So you have acute pain, which is essentially pain that's been lasting less than 6 months. So once somebody's been dealing with pain for longer than 6 months, it becomes chronic. And so acute pain can be anywhere from an event that occurred where they have been hitting off of a mat and taking a lot of swings and a lot of wedges, and there's somebody that takes more of a deep divot, and they end up with one swing and boom, my elbow's been killing me since. That's more of like an acute event. But then you got people that have been like, yeah, I've been dealing with this back pain for about a couple months now. It's still considered acute, and it's just it. I don't remember doing a specific thing that caused it. It just kind of came on gradually. So with those people, I mean, we find that if somebody's been dealing with symptoms less than 6 months, the chances of them getting better are pretty quick as far as timeline goes. Somebody that's been dealing with symptoms for a while, we have found that it's very interesting that because you get people that are like, oh, I've been dealing with back pain for 20 plus years. And it's like, okay, like what's exactly going on here? And we have found that there's Adrian Lowe is a PhD neuroscientist that studies pain, and they found that tissue healing takes about a year for tissues to heal. And so why is somebody having pain past 1 year? And the question becomes, is the tissue still injured and that's why they're having pain? But what they found is that neurological signal in the body, telling the brain that there's a threat going on in the body, which is like the pain system, the alarm system going off. They found that these people, their tissues were healed, but they were still having pain. It was more of a neurological, just that feedback loop was going so long. And so those are the people you got to sit down with and say, hey, like, it takes about a year for those tissues to heal, and you're dealing with symptoms greater than a year. This is That's where you should try to educate them. And there's like a little graph I'll draw people on like a whiteboard and kind of explain to them that we have to do exercises and things that are going to help decrease that sensitivity of the brain and limit that sensitivity to where they can start to do activities and exercises that don't set that alarm system off. And that's how you tap into the system. But that's kind of pain in a nutshell. But when it comes to working with people that are dealing with symptoms like less than a year or less than 6 months, usually what we're doing with those people are trying to figure out like, okay, where's the pain coming from? Is this like a muscular problem? Is this like a tendon problem? Is this a ligament problem? Um, Tendons is what connects muscles to bone, and ligaments is what connects bone to bone. Okay. And so people can be dealing with pain, and it could be bone related or one of those soft tissue structures that's causing the discomfort. And so really when I evaluate somebody, I figure out, okay, where's the pain coming from? So we'll do like special tests. We'll try to figure out, we'll palpate, we'll figure out like where's the pain coming from. The second thing we want to figure out is like, what is the underlying problem here? Like, why did this happen in the first place? Is it because of poor range of motion, or is it because of weakness around that area that is causing you're not able to control that joint very well? So you're putting too much stress in that area, so therefore you start to overload the tissues, which then leads to injury. So those are the things that we try to figure out during our exam. But for example, most often if we're dealing with somebody with low back pain, some of the things that we see with those people are when the golf swing, it's a violently rotational movement. And so you need to rotate through the hips, you need to rotate through the mid back. And oftentimes what happens is people end up rotating too much through their lumbar spine, which is like the lower back. And that lower back isn't really made to rotate very much. There is a little bit of rotation involved in the biomechanics of the golf swing, but most of the rotation occurs through that upper mid back and through the hips. And if somebody's tight through the hips and or through the mid back, their body's going to try to get it through that lower back. And that's where a lot of issues can occur. So oftentimes when I'm seeing somebody with low back pain, usually the first thing we're checking is like, how's their hip mobility? How is their thoracic spine mobility? And oftentimes they're stiff in both areas. And so most physical therapists, they're going to want to treat the low back, which I think is really good. But if you don't fix the underlying problem to why this happened in the first place, they're going to end up going and playing multiple rounds and being like, gosh, my back flared up again. What the heck? What's going on here? So with those people, we'll do things. Well, I kind of separate it into 3 phases when I work with clients. Phase 1 is going to be to try to get their symptoms under control. So if it's like the muscles are guarded because they're, the brain senses pain in that area, oftentimes they'll tighten the muscles around the joint to try to protect it. And that's like your body's way of like creating stability. And the muscles being really tight around that area can cause discomfort. And so if the muscles are really tight, guess what happens to the blood flow to that area? It gets restricted. And so oftentimes what we'll do is like we'll do some dry needling where we take really small needles like acupuncture needles and go down into the muscle, and we'll add in a little bit of electrical current to those muscles and get them pumping. And that pumping effect causes fresh blood flow to come to those muscles, get them to release. Then from there, we'll do like soft tissue work. That's like in phase 1. We'll do everything we can to get their symptoms under control. That has been shown to be really beneficial. We had a golfer that had been dealing with back pain for like 10 years, and he couldn't rotate in the golf swing. Once we dry needled his back and got him really loose, he was like, this is the best my back has ever felt. He was just like amazed at the results of it. But then from there, we worked on phase 2. We started to work on more mobility through the hips, through the mid back, did what we could to loosen those areas up with some more manual therapy. We'll do like dry needling to those areas, or we'll do soft tissue work, or we'll do manual stretching. And then we'll teach them exercises to start moving within that new range that they gain. And once they start to move through the hips and get those hips moving and start isolating those areas and the mid back, then from there, they start to learn actually how to rotate through the mid back and the hips. And then from there, they're taking a lot of less stress off of the lower back. And so then they start to feel a little bit better. But then phase 3 is really all about strengthening and stabilizing that area and teaching those muscles how to control that movement, which is really, really important, because that's really where the rubber meets the road. Yes, we get them symptom free. We get them symptom free. And then from there, we end up essentially strengthening and getting them to control that area. And that's what decreases the chances of like their low back pain coming back down the road. So that's really our focus when it comes to working with clients is A, figure out where the symptoms are coming from, B, figure out what's the underlying issue that's leading to this. And then 3, how can we keep this from coming back in the future? And then from there, they then have a good routine that they're to be working on like a couple times a week so that they can continue to build strength and decrease the chances of like, these issues popping up again. Okay.
Yeah.
So I would say that's the biggest thing in a nutshell that we focus on when we're working with golfers that are dealing with pain. Does all that make sense, Rob and Eric?
Oh yeah, for sure. Makes tons of sense. And think about the normal American like dad that's playing golf, right? We're sitting at a desk all day, hips are getting tight. We're staring at our phone, so we're getting the forward shoulder, like forward neck look. Right. And all of a sudden Andy says, hey, if you have a tight upper thoracic spine and bad shoulders and tight hips, you're going to have a hard time with your lower back. And that guy's actually buying speed sticks and things and trying to hit bombs. And it's like, no. We've got some work here on the structure to deal with, right? And I will tell you that this is what I see all the time. We can see it in the bay. Like we can see you can see the look, you can see the hips, and you're kind of like, you have to have a little bedside manner with the student at times because you're kind of like, oh, well, how's this feel and how's that feel? And you don't want to offend anybody, but you also, when they're trying to find sort of the high end of their performance, you also, as the coach, have got to be like, hey, maybe the capabilities aren't quite there physically, but maybe there is a solution to that as well, right? So Rob Fales, how do you take on that approach with a student who's, you clearly see they don't have the movement capabilities, but they're trying to really get better at it. So what's the discussion like for you on that end?
For sure, yeah. And just based off of my education, what I try to do is I try to give them the best starting point as I possibly can. I see a lot of people who their center of gravity is pitched way, way, way forward. They do not have an ability to take a full inhale. I see them walk poorly. I see them just in general standing in a way that's decreasing that space, decreasing that ability to get air, to get blood flow into those places. So I try to get their entire foot on the ground. Like if I can get them to secure a heel, to secure midfoot, to secure base of the big toe, and then if I can get them to just give me a full inhale in a way that is expanding the rib cage, is expanding the area around the pelvis as opposed to just keeping it up in the mouth. And if I can get them to just move, just give me a little bit of like bounciness to what you're doing. Like give me a little bit of like, you can skip, you can jump rope, you can, anything that you can do that's going to get, essentially your, Dr. K calls it your guts, but like anything you can do to get your guts up off the pelvic floor, is what I try to encourage, not only in the golf swing, but just in the warm up even, before they start swing. So I try to get them into a warm up. I try to get them standing better. I try to get them breathing better. And then I see a lot of golfers who have concepts in their swing that's giving them a lot of pain too. So it's like side bend is like a good one. Like, okay, people have been told that they have to like side bend in their golf swing. I was like, yes, like if you hook me onto 3D, you're going to see, like if you're separating these planes of motion, you're going to see like the side bend graph going up. But does that mean that your spine is isolating this kind of very two-dimensional kind of side bend movement? No, that doesn't happen in a golf swing. So, from there, it's a lot of concept. Like they think they're supposed to turn in a golf swing, which is keeping everything kind of, all these segments kind of locked together and kind of moving all kind of in the same speed at the same direction. And I try to get them to actually separate and try to create basically a relative motion where one side's moving forward relative to another. And that's pretty much where I stop. Anything as far as like, hey, but like, what do you think about this? What do you think about that? I was like, all right, well, that's a little bit above my pay grade. But what I find is that if I could just get people standing better, breathing better, then I just had a client the other day, like who he kept kind of like referencing his lower back. And I just had him stand in kind of like a fencer or kind of like a warrior two pose and just breathe for me a little bit. And I just kind of cued him a little bit to like, hey, can you get some air down here? Can you expand back here? And like, about 20 minutes into it, it's like, yeah, lower back feels better. So again, it's just a lot of that really kind of simple stuff that we learned from Dr. K, but I don't want to talk too much, Andy. It's you're the expert here. So any thoughts on that?
Do you ever find some of the guy, or I feel like most men are very, very stubborn.
Yes.
So they would rather take like 4 200 milligram ibuprofen than go see a physical therapist.
Yes.
You know what I mean? It's
Correct.
just way easier, right? They don't have to spend time out of their day to go see a PT. So I also find that as well, that some people are just like, I've been dealing with this back pain for a while, and I'm okay. It's going to be fine. I'll just pop a few Advil and get through my round. And so you try to work around that, right? Because you don't want to like say,
sure.
you need to see this physical therapist. And in their mind, they don't really have any desire to do that, So you always got to
Right.
figure out who you're working with. You got to kind of like plant that seed and see if like, okay, this guy does seem or this female does seem very interested in getting help. So yeah, I see it both ways. Some people are willing to get the help. Some people are just like, hey, I've been dealing with it for this long. I want to go ahead and just continue on my merry way. So
Yeah.
It's that whole growth
sure.
mindset thing, right? It goes back to, do I really want to learn? Do I really want to improve? Can I get something that's going to help me grow as a person deeper than just like, does my back hurt a little bit? Like, I think you just have to take that step forward sometimes. I had one though that was worse than this, Andy. This is kind of what brought up the idea of having you on, because I had someone come in to see me who was a great athlete, never met him before, and he was like, "Hey, yeah, I've played golf on and off because I've got a herniated disc, and I get physical therapy." He's young, a lot of speed, tons of speed, and essentially, I taught him how to stand, like Robbie just said. Like, this is someone who was taking golf lessons and getting physical therapy, and I simply asked a question like, "What did they tell you about your swing that's causing the pain? Because it's from golf, right?" He's like, "Yeah," and he said, "Nothing. They told me nothing." I said, "Not the physical therapist, not the golf instructor. No." So he clearly went to a physical therapist that wasn't focused on golf, right? Like, they were trying to help him feel better. It probably did a good job of it. Like, he was feeling better. But I said, "Look, we got to figure this out right now, or you're going to keep going down this road." And so, we did it from our end, like working on standing, like Rob said, and try to get him. And it immediately helped him. Like, immediately, he came back a month later and was like, "Yeah, I'm playing the best golf of my life. I don't have any back pain anymore to speak of." And but that's the frustrating part to me, is like, both us as the PGA golf instructor and hopefully as like in the bigger medical sense, like, if someone's having pain from golf, do you think they should probably go see a PT that has a little bit more golf centric experience? Is that probably, I think that would probably, like, I think the assumption that every PT understands the golf swing is probably not true, but I'm assuming that. What would you say about that in your industry?
Yeah, that's so yes. I think there's PTs that are going to help some of these golfers get out of pain. But if the reason they're getting into pain is they've got pretty good mobility and flexibility, they may have some weakness, and so the PT is going to work on some strengthening, but they may be doing something mechanically that's just putting a ton of stress, on their elbows or their back. And so that's one of the things that we like to do, is take a down the line and a face-on view of the swing and just see if is there anything excessive going on in the swing, like reverse spine angle, uh, or they're casting significantly, causing that medial elbow pain from on the trail side. So those are some things that we look at: our wrist position at impact, in regards to elbow discomfort, and then also if they're doing some excessive bends during the swing, that we want to take a look at that and see if that potentially is a reason that they're having issues. So
Can we
we
back
had
up
one
to
guy that was, yep.
can we back up to what you found with is there a correlation in wrist position and impact with pain that you've found?
If somebody's dealing with, like, if they're a righty and they're dealing with medial elbow pain on the right side, which is their trail side, usually in the position of, so you have muscles on the inside of the forearm that grip and they flex the wrist. And so those muscles right there attach to the inside of the elbow. What we find is that when they're coming into contact with the ball at impact, they're casting or they're scooping, and their wrist is in this position at impact, and everything's really tight, and then they're making contact with the ball. And so it's putting a lot of stress on the inside of that elbow. Same with somebody that's having trail side lateral epicondylitis on that outside elbow. They tend to have their hands more forward, but it's pretty rare. It's usually, they're usually, if they're going to cast or scoop, it's pain on the inside of the trail side elbow and pain on the lateral side or the outside of the lead side elbow is what we find is most common with these players. Because, as you know, wrist position, hands a little forward and impact is a great position to get into for a lot of the golfers. And so if they're doing that casting, they tend to cause a lot of discomfort on those elbows. Does that make sense?
Yeah, for sure.
Okay. Yeah, we had one guy that was, so he was dealing with like significant low back pain, and we took a down the line view, and we saw his feet were so closed to the target, and I think one of the instructors was having him try to do inside to out swing, so he's having him start with his feet really closed to create that inside out swing, and he was just coming across and just torquing the heck out of his low back. We had him just open his stance up a little bit where he lined his feet up with the target and then line his shoulders up with the target to even those out. And all of a sudden, he's like, gosh, my back feels way better. I'm not like, coming across and just torquing the heck out of it. So I mean, little simple things like that. I think it's really important to be able to look at the swing, because most physical therapists, they have no idea what to look at in the swing, and that's, going through the TPI medical level 2 certification just allowed us to look at a lot of the mechanics and things that golfers can go through that are some red flags that are happening. And this is something that we love. Like, hey, this is what I saw during the video when I was looking, and passing that information off to you guys to say, hey, what are some things that you guys can do mechanically from the swing to be able to potentially offload some of those structures? I think that's where the communication is really key. And then a lot of the students are like, wow, like I feel like a PGA Tour player. Like I've got a team around me communicating. This is awesome. So I think it's just a great way to provide a high level of service for the students.
And then what are some, I mentioned earlier about concepts, but what are some of the concepts in terms of how we're standing, even in swing, that you find that are problematic, more from like a, in all of your experience, what are some of the more common concepts that golfers need to get away from?
So one of the big ones for us we'll see down the line is early extension that occurs, where somebody, they come into the backswing and their hips, we draw a line on the back of their hips and they look really good. Their right butt cheek, if their righty, is on that line. And then when they go to start the downswing, they tend to stand up or move closer to the ball and don't learn how to actually rotate the pelvis. Sometimes what we find is these people early extend because they're starting with weight through their heels, or their center of gravity is actually back behind their ankles. And so one of the things that we like to look at from down the line is the outside hip bone. So their greater trochanter here on the outside of the hip, which is like right near the pocket line, is that directly straight down over the lateral ankle. So like the outside ankle bone here, see that outside ankle bone? So we like to see, is that in line? Sometimes these people's hip bones are behind the ankle bone. And so in order to gain balance, or in order to keep balance and stay upright, their center of gravity has to move forward closer to the ball. And that can cause a lot of issues. They move closer to the ball, and all of a sudden they got to bring the hands in and go more out to in type of swing. So then they have an out to in swing path of like 4 degrees, and then they have to open the club face and actually, in order to actually get it to go straight, and then they end up with a high spin rate and they lose distance. So that's kind of one of the things I see when it comes to people standing, is they're set up. Their center of gravity is so far back that when they go to swing, in order to maintain their balance over their base of support, they have to move closer to the ball. Does that kind of make sense?
Oh yeah, that alignment, and this is 100% observational, but that alignment of the hips sitting too far back behind the ankles is number one. Typically when people are having back pain, I see that a lot. But probably the people who come in and say, "Hey, I've got the worst pain, like I want to quit golf right now," which I get probably several times a year, is that setup. And then also way too much like excessive lateral motion of the pelvis. So they're moving forward because they sat back too much. And then they're sliding, left knee staying like very soft. And the left hip is then extending over the front foot. And then all of a sudden, they're toast at that point. That the lower back has taken so much. And they're, to Robbie's point, they're trail side bending at the same time because their hips are moving so far forward. And it just, all that pressure that builds up, that seems to build up in the hips and the lower back, just really hard to deal with.
Yeah, we'll see. So lack of hip mobility, so inability to be able to rotate the pelvis. So one of the things we'll see is people, they'll sway and then they'll slide towards the target to create that momentum, or that swing speed. And they don't really have the adequate hip mobility to be able to turn the hips and be able to kind of stay centered. And so they end up swaying a little bit too much. And then that causes them to feel their heads moving. And then they're like, okay, they're trying to hit a moving target. So that can lead to poor ball striking. So that's another thing that we'll see is from the face-on view if they're swaying or sliding too much. Yeah.
No bueno.
The human body it's pretty amazing. The human body is amazing, and just being able to understand the biomechanics of the swing and being able to figure out, like, I think it's just so cool. Like, that's the reason I love what I do, is because you're almost like a mechanic for a car. You're a mechanic for the human body. You're trying to figure out, like, based on their swing, you're using all of this data and all of these all of these inputs of measures, tests, range of motion measurements, strength measurements, coordination. You're looking at their swing on video, and you're putting all these pieces together. And you're creating, like, okay, this is what's going on. And if you can figure it out and then come up with a game plan to be able to solve it, I mean, these people, they'll be like, man, I've been dealing with this for like 5 years. Nobody's been able to figure it out. And, like, finally, somebody's able to tell me, hey, this is your issue. And for you to be able to, like, show it to them and say, hey, this is exactly what's going on, and this is the plan that we need to do to get it going and get it to improve. And then they're like, okay, let's go for it. And then you start to implement that plan. They start to do the homework that you give them. And, like, that is so addicting. And they come in after weeks of working with you, and they're like, this is the best I've ever felt. I've even shot, a better score. I mean, we had a guy the other day, last week, he came in and he was like, man, my back's feeling loose now. I can actually create a good turn. And I broke 80 for the first time in over a year. And
That's awesome.
he was, like, ecstatic about it. I mean, like, that is so addicting to be able to help people through that. It's like, you're not working a day in your life when you have people go through those experiences. So anyway, I love it.
It's
I mean,
awesome.
You guys have people come in and tell you, like, I shot scratch for the first time ever.
Oh yeah.
Yeah. No, that's why,
is that
to your
rewarding or
point.
what?
No, it's very rewarding. But the most rewarding is, like you were saying, when you get performance plus feeling better. And I tell people all the time, and this is for the listener, okay? Like, if you have a golf issue, like golf performance, and you have pain, you don't have two issues. You have one issue, which is you got to get the pain figured out, right? The golf performance piece of it is so small compared to what's going on in your body, right? It's something that you have to listen to. And it's one of the only reasons, and we talk about this framework of, like, development in the swing, which I don't know if you've heard that episode, Andy, that we did about sort of like when is the right time to change your swing. And we kind of laid out that the number one right time to change your swing is when it's either causing you pain or about to cause you pain. And it's like, that's the number one deal. And I believe that 100%, but I think that golfers don't ever think about that. I mean, I'm making generalizations, but hey, I want to play better. I need to swing better. I need to swing faster. I need to do this better. But there's a whole hierarchy of, like, understanding how the body works and how the swing works and how you develop skill. And pain is absolutely a huge part of it that nobody talks about. And I'll tell you a quick story. I had this guy I've taught him for 20 years, and he's a good friend of mine, and we joke around a lot. But we were working on his game. He was playing bad. He was frustrated, and he was coming to see me, like, it felt like once or twice a week, and we're doing lessons. And he's like, yeah, I'm just not playing well. I played terrible. And then he's, like, limping off the range tee. And he's like, oh, and by the way, I'll be out for 6 months. I'm getting my hip replaced. And I'm like, well, it wasn't 6 months. It was like 3 months or something. And I said, you're just telling me now that you're getting your hip replaced? Like, think about all the stuff that had built. And he's a listener to the show, and you know who you are, sir. You're listening to the show right now because we joke about it. But the fact of the matter is, think about all the things that went on for months and years leading up to needing a hip replacement, that in your golf, you're just like, you know what? It doesn't bother me. Like, I can just overcome it or whatever. And, we're like that. We tend to be a little bit resilient. Men and women both, by the way. This is not a man thing generally. And so you've got to be, if you're dealing with something, you have to realize that it affects your golf game. Let me ask you this direct question, Andy. Somebody comes to you and says, hey, I saw the orthopedic. He says I need my knee replaced. Okay. But it's June and I'd like to do it in November so that I can kind of rehab during the winter and then start in the spring. I know what I tell that person when they ask me that and say, hey, can you help me get through the season? I've got some advice on that from my side, golf performance wise. What is your advice there from the PT side of it? Do you take that on, or do you offer them advice in a different nature?
Oh, absolutely. So this is great because this has happened. This happened last year. This has happened. This is happening currently right now with someone. So it really comes down to how bad is it for them. So if it's like debilitating and they're like, gosh, I can't even sleep at night. It's killing me. They've done injections. We've had Synvisc shots. I've done PT. Like it's just not improving. Then, and they're like, I just got to get this thing done. Then it's up to them. It's kind of like, okay, well, all right, go ahead and get the knee replacement and then just know that you're going to be out of golf for the rest of the season. And then by spring, you're going to be really rehabbed and ready to go. But most of the time, I'd say 90% of the people, they want to keep playing golf and they want to push it off till November. And I'm all for that. And most physicians, especially the ones that play golf, they understand, right? Because golf is great, and especially during the warmer months. So they'll say, "All right, we're gonna try to push this off as long as you can until November," and they're gonna give them more, conservative type treatments like the injections, the cortisone shots, or uh, Synvis shots, or like a knee brace, or some type of like a heavier non-steroidal anti-inflammatory like meloxicam or some type of oral medication that they can take to kind of like get them through the rounds. And so that's most of the time what people are doing. And then they'll opt in for the surgery. And I think if I was to get a knee replacement, it'd probably be November timeframe because wintertime, you're not really going to be playing much golf. And then by March, April, you're golden. You're ready to go.
Yeah.
So I would say that's kind of the answer I have. It just depends on the person and what their overall goals are and how bad it is.
Yeah, my worry
Great
there
question,
is
Eric. I love it.
is how much the swing changes when you're compensating for the issue. And then you're going to work into a new swing stuff, and then you're going to come out of it. And it goes back to what you mentioned earlier about the pain still lingering on in your brain for ages afterwards, right? So like, it's like, I'm going to learn this new compensation, probably put some stress on the other side of my body that's undue, play
End up playing
crummy,
whack-a-mole, right?
yeah, play crummy golf anyway,
Right.
take a bunch of anti-inflammatories that are terrible for my guts, and then I'm going to get the surgery done.
Right.
And then I'll come back and have to fix all the compensations that I made in my swing. And there's no right answer. And I get why people make the decisions that they make. But to your point, I guess there's some that it's just not as bad as others. But man, it's almost like, maybe just you got to make a decision and realize like, no matter what, you're still going to play worse golf in the next like 4 months. Like it's going to be a problem leading up to it. And it's not going to be like
Right.
magically
Yeah,
okay
yeah.
if you get an injection, in my opinion. That's what I've seen.
Like if I get it, if it's like a time set, like, hey, I'm only going to take this trip to Scotland once. This is the only time I'm going to be able to do
Mhm.
this. So
That's
it's like,
different, yeah.
I want to go play in Scotland, or it's like, hey, I get to go play Pine Valley or Augusta. Like, all right, hey, whatever. Like just, but if
Yeah,
it's not something like that,
absolutely.
then I'm with you, Eric. I think you try to get it resolved as quickly as possible or as early as possible, and just eat that one in season and just accept it.
Yeah.
You
Totally
don't want to
agree.
be creating like poor motor patterns and ingrain some poor swing habits because obviously then you guys have to work a little extra harder to try to get them out of that. I mean, it may be a good thing. They may see you for more sessions or something. No, I'm just kidding.
It's all good. Well, Andy,
Yeah.
do you have anything you'd like to add here at the end of the conversation? We really enjoyed having you on, and either one of you, if you have any thoughts,
man.
I just want to say thank you for coming on. I know it's hard we're all in the same thing. We're busy during the day, and we got kids at night. We're trying to fit this in between, but I kind of felt like there was a story that needed to be told. It's not my world, right? And that's what I think, that there is a line between people's specialties, right? And Andy Royalty will look at golf swings and try to help people, but not in a way that's overlapping what a golf instructor is going to teach from a golf swing or skill standpoint. And I'm going to have some thoughts on people's
Right.
bodies, and Rob Fales will too, in a way that doesn't overlap because it's not our area of expertise, right? That's why you have the name Dr. Andy Royalty, right? And so I just appreciate those relationships, because if we could keep those communication lines going, golfers can just benefit in so many different ways. But at the end of the day, the golfer has to be open enough to be like, hey, I can't just ignore what's going on or think it doesn't affect my performance. I've got to at some point go, you know what? It may affect my, like, oh yeah, my rotator cuff's partially torn, but it's not affecting my swing. No. That's a fact. I hear
No,
that.
it is.
I hear that once a week, and I'm like, no, like that's definitely affecting your swing. We just have to accept it. I mean, we can maybe work around it, but it's definitely affecting the swing. So anyway, I just want to say I appreciate you coming on, and I just wanted to say that I think that there is a solution to some of this for people, and if they just take the time to kind of work through it, it's not fun. I mean, I was dealing with some hip pain, and I texted my friend Dr. Andy Royalty, and I was like, hey man, I saw this Instagram post you did about hip pain, and I think that's me. Like, what do I need to do? And you helped me out. And no, it's just a text message, which is really nice, and it's helped. My hips do not hurt anymore. I did the exercises, and everything is fine. So that's what I had time for in the moment. But anyway, I want to say thank you for coming on. Any thoughts, Rob Fails, for Andy before we give him the mic for the one last minute?
No, yeah, no. I appreciate you taking the time and coming on and sharing your expertise. And yeah, looking forward to hopefully maybe sending, hopefully not, but because I don't want my students to be injured. But when and if that's the case, send some folks your way. So I appreciate it.
Just being able to make a text or a call and just say, hey, my student's dealing with this, and this. What are some things? Because if I can be able to add value to what you guys are doing and say, hey, have them try these things, and it saves them the hassle of having to go, jump through hoops to come out to see us, then to me, that's a win. So,
it's a win for everybody.
I appreciate it.
So we will link the Royal treatment on the on our show notes. You have to check it out because he has a good website and he does some good social stuff. So you want to follow him on the socials, and we'll link those there as well if I can figure out how to do that. We just want to appreciate you coming on, sir. Any last things you want to add to the people? Tell the people anything you want, Andy. The stage is yours.
Yeah, I think if you're somebody, most of the time when we're seeing people, it's like it's very rare that like, hey, I've been dealing with this for 2 weeks. Usually it's somebody they've tried a lot of conservative stuff. They've tried to rest, and it just continues to come back. And so if they're not fixing the underlying problem, then they're just essentially going to be going through that same cycle of they rest, it gets better, and then when they play a lot of golf, it gets worse, and then they rest again. So might as well just nip it in the bud and fix the underlying issues so that they can essentially be able to get back to golf and not have to worry about the issue continuing to come back over and over again. So I love what I do, and I'm excited to continue to help more of the Richmond community be able to play golf and enjoy it and just enjoy what they're doing, not only on the course but also off the course. So
man, well, I appreciate you, and I think the point of the story tonight was there's light at the end of the tunnel. So you can actually work yourself out of this, feel better, play better. Those things go together. So thank you for coming on, Doc. Rob Fails, as always, a pleasure to have you on. What a good episode. I think a lot of people are going to get a lot out of this. So thank you, gentlemen. Have a great evening, and thank you for tuning in to the Golf Intervention Podcast.